احنا دلوقتي كده خلصنا evaluation of fetal growth اللي هو screening يعني، وشخصنا fetal growth restriction أو small fetus. How to evaluate a fetal growth restriction. During evaluation we try to find an etiology of fetal growth restriction through history and examination. في الهيستوري assess for maternal disorders associated with fetal growth restriction such as preeclampsia, history of maternal infection ممكن تكون هي سبب fetal growth restriction, and identify risk factors. Perform a fetal anatomic survey. About 10% of FGR is accompanied by congenital anomalies. Examples include omphalocele, gastroschisis, diaphragmatic hernias, skeletal dysplasia, and congenital heart defects. Regarding genetic testing, according to the Green Top Guideline, it is indicated in severe SGA with structural anomalies. severe SGA اللي كان مقصود بيها less than third centile. ولو ما فيش structural anomalies, the presence of SGA before 23 weeks, especially if uterine artery Doppler is normal. يبقى دي two indications for genetic testing according to the Green Top Guideline. احنا عندنا genetic tests include karyotyping, FISH, microarray, and exome sequencing. The Green Top Guideline recommend microarray for genetic testing. بيقول إن microarray has a yield of chromosomal abnormalities more than karyotyping. There is a 4% incremental yield في حالات اللي ما معهاش structural anomalies, and more than 10% incremental yield if there is a structural malformation. يبقى microarray is recommended. طيب الأحسن منه هو الإكزوم sequencing. بيقول لنا الإكزوم sequencing has limited incremental yield over the standard karyotyping and microarray in fetuses with isolated FGR, and it is offered if there is a multisystem abnormalities or there is isolated short long bones. Regarding infection screen, serological screening for infection should include congenital cytomegalovirus and toxoplasmosis infection, malaria and Zika virus in high-risk population, especially those with relevant travel or exposure history. A full torch screen is unnecessary and it should be based on history and presentation. يبقى الحاجات recommended لكل الحالات هو cytomegalovirus and toxoplasma, malaria and Zika virus الحالات اللي جاية من endemic areas of these viruses. Full torch is not recommended, unnecessary, and it should be based on history and presentation.